Good morning and welcome to another edition of the Black Male Podcast. I'm your host, AP, and today's show is going to be on the subject of medicine. Okay, today I have a special guest, and it's an honor and a privilege to introduce to everyone Dr. Ryan Duncan. Dr. Ryan Duncan is a doctor of pharmacology. First of all, I want to say thank you very much for joining the show, sir. I also want to thank you for being a young African American male that's doing and learning and going a different route than what we're usually going. As being a young African American male, I'm going to give you your flowers right now. I just finished listening to Killer Mike. I love Killer Mike, the rapper, right? And in his song Reagan, he said we have a lack of understanding because all we do is give them is some balling and some dancing. Okay?
Right.
So it's for a young man, a young African American man that's going the route that you are going, sir. I want to give you your flowers, sir. It is very important for us to see of people of color that there's other routes that we can go and that we can be successful in different arenas. Now, a long time ago, these are the things that were afforded to us, but somehow we got away from that. So one thing with medicine and what I really wanted to tap into was because why is it important for us as African Americans to understand the concept of medicine and how that medicine will affect us? So first I want to open the floor to you, sir. You can introduce yourself to everyone and then we'll get started.
Hey, how you doing, man? I appreciate it. First of all, thank you for those words. You know what I mean? Like I'm real grateful. My parents, the way I was raised, the people around me. I feel like, they deserve a lot of the credit. God, of course, for getting me to this point. So
Right.
now definitely I appreciate that. And good morning, y'all. I'm Ryan. Nice to meet you. I'm a doctor of pharmacology from New Orleans originally, West Bank. Grew up there. Went to Shaw in Marrero for high school, and then I went to Xavier University for pharmacy school. After that, I moved to Texas, so I'm out in Houston right now, and it's a pleasure
Okay.
to be on the podcast.
All right. I appreciate
To
you. I
answer your
appreciate you.
question, oh, I'm sorry to interrupt you.
No, go ahead.
To
Go
answer your
ahead.
question, though, I definitely think it's important. You want to, so anytime you have anything going, especially with medicine, right? You'll find a lot of studies around. You can find a lot of articles online about how you see these disparities in treatment, especially with minorities, right? One of
Yes.
the common misconceptions in medicine in general is that minorities, especially Black people, need to be treated differently, or they have to follow these different medical standards or medical guidelines. And we coming to find out that's not true at all. You know what I mean? Over the last few years, a lot of those studies have been proven false. So it's definitely good to understand what's going on. You always want some insight on what you're doing to your body in general. Um, and definitely, you do want to have trust in your providers, but you do want to, take accountability for your own health and yourself.
Okay. So you mean to tell me if I get medicine and I take the medicine as prescribed by the doctor, I can't smoke or I can't drink with that medicine?
So some medications you can't, you know what I mean? And you look, everybody like to have a good time. And as a healthcare provider, I won't sit here and necessarily say, hey, um, I advise you to drink with medications. You know what I mean? Like you can't say that as a recommendation. But in general, if you couldn't take medicine without drinking at all, half the world wouldn't be taking medicine, right? So
Right.
you definitely want to be able the main thing is knowing what the medication does to your body and then how the alcohol and stuff like that is going to affect that.
Right. Do you think the reason why we do that is because we don't know better or because we don't have the information or we fail to ask the critical questions when we're prescribed meds?
I think that's part of it. You know what I mean? Having the general understanding is the basis to knowing what questions to ask. You know what I
Hmm.
mean? Like if you don't really know enough about the topic, a lot of times it is hard for people to find the right questions to ask. So that's why I do say it is a part of your healthcare provider to provide you with that basis of information, right? Anytime they give you any type of treatment.
Okay. Is there a difference between name brand medication that's prescribed to me or a generic brand? Because sometimes I can take a generic brand and I got more faith in that generic brand, or I might not
Yeah.
just have the money to pay for that expensive brand. So I'm
Nah, absolutely.
bargaining with you taking that generic brand and it works for me.
Nah, definitely, definitely. Good question. I would say It's weird, right? Yes and no. So in general, when you talk about medications, most health fields, you actually just go by the generic name. So, for
Okay.
example, a common medication is amlodipine, which is the brand name is Norvasc. It's a blood pressure medication. So,
Okay.
in the medical field, we're gonna always refer to it as amlodipine because that is the drug. It won't change, right? Norvasc is the brand name, but you can have about 10 different brand names for medications. Ibuprofen, for example,
Mm-hmm.
Advil and Motrin is both ibuprofen. So you do want to kind of understand the difference. You do want to go by the generic just because you do want to know exactly what the drug itself is. Now you do see quality disparities between brands and generics, right? Like because these different companies, these different manufacturers get a hold of the patents to make the medications, and you don't know what else they produce. And a lot of these factories, especially in America or these other countries, are producing food and you know what I mean, processing
Mm-hmm.
other things. So that's where you run into a lot of the like for example, you say you might take one generic and you feel like it works great, and then you
Right.
take something else and it's not working as well. A lot of
Okay.
factors go into that. It could just be the dye that they have inside of the coating for the
Mm-hmm.
medication. If you have a dye allergy, then of course your body won't react well to it. If it's in a factory that also produces peanuts or something, right? And you have a peanut allergy,
Right.
if you take a tablet from that particular manufacturer, your body might not react well to it. So I definitely recommend experimenting. Try different brands of stuff if you do have, especially with the over-the-counter medications. That's where you see a lot of that variance in. I do recommend just trying different things before you give up on the medication completely.
Mm-hmm.
That way you can find out what works for you and what doesn't.
Okay. Do you see a big disparagement with the medicine that's prescribed to African Americans as it is to other races or cultures?
Yes, absolutely. Kind of touching on what we opened with, kind of that same topic, right? It's a big misconception, even in medicine, it's surprising that black people in particular have to be treated differently, right? Like you'll
Mm-hmm.
see studies and articles about how even when it comes to pain management, for whatever reason, doctors think that black people have a higher pain tolerance,
Tolerance.
right?
Mm-hmm.
Yeah, and it's like it doesn't make sense, right? We all human, we all bleed the same, we all breathe
Right.
the same, so it doesn't make sense. So that kind of goes along with that. You do see a lot of common blood pressure medications, for example, a lot of your diabetic medications that they'll kind of just throw black people on and just be like, oh, I hope it works. But now, especially when heading into the new age of medicine, you are
Mm-hmm.
starting to see a lot more DNA and genotypes and different types of more specific medication therapies tailored to the person. You'll start to see that more, I feel, as the years go on. We're probably a little bit far away
Okay.
from it being optimized, but you'll start to see kind of more tailored medications by people, DNA, blood results, blood type, even. You're
Right.
starting to see things pop up. So it's definitely something that needs to be worked on in the medical field in general. But it is getting better slowly over time, though.
I'm glad you touched on that at the end. I work in a behavioral psych facility, and I know that the doctors will prescribe medicine. Sometimes they're throwing an egg in a basket to see what works with the patient,
Hmm.
and they have to look and see what the medications the patient has already taken, and then they have to see what has worked if they've been a patient of ours before or any other previous admission that they've had in another place. One thing that I do know is if you and I were taking the same medicine, I know it's going to affect us completely different based on our genetic
Hmm.
makeup. I mean, although we have the same color skin, we have different things in our DNA that's going to affect us different. I think that's something that's important for all of us to understand. One thing I do know is, and I have realized that it is a shot in the dark. Medicine is not like a cure for everything.
Yep.
Sometimes it's something that will just alleviate my pain or get me to be stable right now. And then once my body's used to it, the next thing you know, I have to supplement that with something else. As a pharmacist, when people are coming in, or when you are giving out the medication, when somebody comes and fills that prescription, when they're getting that main prescription, do people usually ask questions about those meds, or do they just take their meds and just walk out the door?
So you do have like the vast majority will just take it and walk out, right? Like I'll say maybe a good 30% of people probably will like take the time to excuse me, like ask and you know what I mean? They're curious
Mm-hmm.
about the medication. So that's I always advise asking, even if it's something new, even if your prescriber did go over things with
Yeah.
you. Your pharmacist is a lot more tailored to drugs in specific, right? So you do want to ask that. We may know something that the prescriber didn't tell you, or important interaction with something that you may be taking. Like a lot of people go to multiple prescribers, right?
Right.
And then those doctors don't really communicate. So you might have one doctor that prescribes something, and then another one will prescribe something, and it's for the same purpose, but they don't know that you already got something else. So we
Mm-hmm.
always advise asking. We all, of course, it's my job to kind of catch that ahead of time. A lot of times if I do notice somebody in that
Mm-hmm.
situation, I will ask them before they take it, hey, before you take this, you also use this. Where they, did the prescribers know about this? Did they want you to take both of them together? So on and so forth. So that's
Right.
definitely key in that aspect.
As a medical professional, do you consider yourself as an advocate for the people?
I do, yeah. Um, and I think if you all your good healthcare professionals are advocates, right? Like I always say. A lot of people go into healthcare and you always see especially when you're younger, right? You always see people be like, oh, I want to be a doctor, I want to be a
Mm-hmm.
surgeon. A lot of it honestly is because of the public view, right? Or
Right.
society. A lot of society in general hold doctors and stuff like that to a high standard, or
Right.
put them on a pedestal.
Right.
Sometimes rightfully so, but we all human. And I feel like you got to know you got to go into it for the right reasons, because healthcare, while it can be rewarding, it can be also stressful, and it can be you do have a lot of responsibility, right? Everybody that come into the pharmacy, you got to look at it like that's my sibling, that's my grandparent, that's my
Right.
mom, that's my dad. So you kind of have those people health in your hand,
Mm-hmm.
to a certain extent. And so that's the main thing. You do want to hold that to a high standard. But yeah, definitely, it's definitely something that's important.
Okay. Okay. What are your thoughts on holistic medicine? I know there's been some studies and some research about holistic medicine. There's folks that are out there, they believe in herbal remedies. As I stated before, long time ago in the slave days, that we didn't have access to medicine, so they came up with the best case scenario where they can have some pain management and some pain
Hmm.
relief. What's your thoughts on holistic medicine, and have you seen a growing trend of people using holistic medicine and like CBD oils and things like that?
Yeah, definitely. So just in general, to answer the question, I do think holistic medicine can be beneficial. Um, just like with prescribed medications, you do want to know, okay, what is this particular herb or whatever you're taking? What is this supposed to be beneficial for, right? And then
Mm-hmm.
how does that fit into my daily routine or diet? It's always a supplement. It's not something you should rely on. Uh, Herbals do have a lot less scientific background behind them in general. You know what I mean? Like when I
Yeah.
release a drug, like if I release a new drug today, it started about in general 10 years ago. So like a lot of the new drugs you're seeing now that may be something that come out this year is something that they started in 2015. You know what I mean? So it's like
Mm-hmm.
it's a lot more scientific background, a lot more studies, a lot more research. Herbals in general is hard to predict how they react to each person. You know what I mean? And a lot
Yeah.
of herbals kind of shift the way they work based on what you eat day to day and how you know what I mean? Like
Right.
what you do. You'll see a lot of studies with cultures like for example, a lot of Asian cultures, they may react differently to certain herbals because like in Japan for in particular, they eat a lot of sushi, they eat a lot of fish. They'll have higher levels of mercury in their
Mercury.
body,
Mm-hmm.
stuff like that. A lot of small particulars. I
Right.
always say herbals can be beneficial. In general, they won't really do you too much harm. If you are taking other prescribed medications, always ask your primary doctor or somebody, a pharmacist, reach out just in general, just to see if that herbal will interact with anything else you're doing.
Yeah. You know, Killmonger said the same thing in Black Panther. He said the same
Yep.
thing. You got all the security around me, but you don't even know what you just put in your body when that lady drank that tea. That's
Yep.
funny that you
Exactly.
said
Just
that.
like that. Just like that. Yep.
Yeah. All right. Do you see a barrier, or what is a potential or a current barrier to taking medication that people face?
The biggest nowadays is pricing.
Uh huh.
I mean, it's really just that simple. It's crazy. You're starting to see a lot of drug prices go up. We got a lot going on in the world right now.
Right.
And with the changes, especially politically, that's going on, I think people need to start paying attention, especially the stuff with other countries. We
Mm-hmm.
do outsource a lot of stuff in America. So a lot of you got a lot of noise, a lot of rah rah for certain people, whatever.
Mm-hmm.
You know what I mean? I'm not gonna
Right.
pick sides,
Right.
but um, everything ain't greener. You know what I mean? Like you got to understand what's going on and what people doing. You know what I mean? The things you're doing to these other countries. I wouldn't be surprised if you see medication prices start to skyrocket or even more over the next few years.
Right.
Because you do have to, you know what I mean? Like the money got to come from somewhere. That's just the way the
Exactly.
world works. Unfortunately, we don't have universal health care in America,
Right.
so everybody need their cut. The
Right.
insurance, the company that's selling it, the pharmacy, the prescriber. You know what I mean? And that's the biggest thing. So you see a lot of people have misconceptions with insurance and thinking, oh, I have insurance, I can just do whatever I want. It
Mm-hmm.
depends on the plan, right? It depends on the
Right.
policy. Do you have a deductible? How much coming out of pocket? And
Mm-hmm.
that's what you run into a lot in my profession. A lot of pricing for important medications, Xarelto, Eliquis,
Mm-hmm.
stuff to prevent strokes and blood clots,
Mm-hmm.
very expensive. You know what I mean? It could be $800 a bottle. So even after insurance, you're probably still looking at a couple hundred in some cases. So I would definitely say pricing is the biggest issue right now.
Okay. What would you
Hmm.
say is a one of your top two medications to give out based on I want to say based on I don't want to say disease, based on series. So would it be like high blood pressure? Would it be diabetes? Would it
Oh,
be
like
yeah?
yeah, I know what you mean. Yeah, oh, blood pressure and diabetes,
Okay.
always. Yeah, so a lot of times in medicine you talk about the trifecta, which blood pressure, diabetes, cholesterol, right?
Okay.
So really I could kind of say it's kind of like a three-way tie. You know what I mean?
Mm-hmm.
More like a top three than a top two. Um, and I mean, look, that's the three that's most determined by diet and lifestyle. So
Right.
that's why, you know what I mean? Like regardless of genetics, regardless of whatever going on, if you're just not taking care of your body at all, then you'll eventually have those problems.
Right, right.
Hmm.
Is there something that in your field and in your professional opinion, besides diet and what we drink and everything like that, something that we can do on the outside of that to help us when we are taking medication?
uh how to take it, right? Or when to
Yeah,
take it.
right.
Sometimes timing is important. A
Mm-hmm.
lot of your thyroid medications, you are supposed to take those on an empty stomach. Most people don't know that. It's actually surprising. Because that's one of the biggest things that they kind of teach you in pharmacy school. When it comes to thyroid medications, is how you take it. You do want to take it on an empty stomach because you do, and especially something as particular is that where the dosing does change often. You do have to follow up a lot with the doctor to get blood work to see if the dosing is,
Mm-hmm.
correct for you. So you do want to take your medications properly so you can know if it's working or not. That way you could increase the dose if you need to, or in some cases decrease it. So that's the most important thing is timing and knowing how and when to take your medication.
Okay. If I am having an issue with that timing and the medication, what's my next step? What should I do? Should I go back to the pharmacist or should I call the doctor?
So the pharmacist will probably be the most readily available person to you.
Mm-hmm.
But either one can suffice, you know what I mean? A lot of times the pharmacist is a little bit what's the word I'm looking for? More knowledgeable, right? It kind of goes back into one of the earlier questions about how different prescribers may prescribe things and not know
Mm-hmm.
that another doctor gave you something else. So, but the pharmacist in most cases can see all of that if you get all your medications at that one spot. You know what I mean? Like I can see
Right.
all of that. So that's why you want to be able to, look into that. And so I would say the pharmacist probably just in general, because we can see everything would be your first priority, but definitely ask somebody.
Mm-hmm. And then you talked about expense being an issue. And you can answer this however you want to. I don't want to put you on
Mhm.
the line right here. You know, sometimes with the access to medicine and what we talked about earlier, the ability to pay. You know, we talked about having the right insurance plan, and sometimes you have self-pay people that they don't have
Mhm.
insurance, but they're trying to wheel and deal to get this medication that they need. Have you ever seen someone come in that need very specific medication that they cannot get, like for cancer treatment or like for certain STDs or even for
Mhm.
the diabetics? Because I know those vials are starting to go up too, correct?
Hmm. Yeah, so that was a big thing. If you remember, kind of, I think Obama administration kind of touched on it a lot, and then Biden administration did a little bit with insulin prices, and
Yeah.
you know what I mean, stuff like that. Something that's important. I mean, that's basically the biggest one, to be honest. Insulin, a lot of your diabetic medications. They're so expensive and obviously they're important, right?
Hmm.
Asthma medications can be expensive too. Inhalers, stuff like that could be real pricey. That's
Hmm.
another important one that you see people can't get sometimes. I usually recommend always look at the end of the day, something is better than nothing. So if you can't afford it, I always recommend reach out to your insurance first. A lot of times your insurance is gonna have formularies and then
Right.
they have tiers within the formulary of the medication. So you have, any given insurance might have, let's say, tier of 1 through 3. Tier
Okay.
one medications may be something that, regardless of if you have a deductible or anything, they'll cover 90% of or 95% of or whatever, right? And then as you go down the tiers, the coverage will get a little bit more lax on it. So that's one thing I always recommend. If you do have something that you need to take or something that your doctor prescribes and it's too expensive for you to be able
Hmm.
to buy, then let them know, hey, this is real expensive, or talk to your insurance, see what alternatives you do have that's more affordable, and then go that route. Because look, you can't help it if you can't take it. You know what
Yeah,
I mean? If
right.
you can't and you can't afford it, then something better than nothing. So it might not
Right.
be your first option or the best option, but if you could get the second best option, that could be just as beneficial. So,
Right. Right.
hmm
I think another reason why I wanted to talk about medicine. My mom has high blood pressure, and
hmm
I talk to my sister all the time. One time I went home and I saw that she has like edema now from the
hmm
medication. So one of the questions I asked was, "What type of medication are you taking, and are you taking it the way you're supposed to?" And now it's just progressively getting worse, and I know that she really doesn't understand why it's important for her to take those meds the way she's supposed to. Because you think about it, in that generation, I'm just gonna pop something, make me feel better, and that's it. And I'm gonna
yeah.
listen to the doctor and just
hmm
let it be it. So my next question is this: when you see something like that, if you are seeing a patient come in and you can tell something is going on with them, is it your duty to contact the doctor, or do you step in and ask that person, is this medication really working for you?
So a lot of times in general, it'll be hard for us to tell exactly if something is working or not, um only from appearance for the most part. In most cases, you know what I mean, some cases
Right.
you can. You do have to get like a lot of labs, so that's one thing that the doctor's offices and stuff have like more insight on. It's
Mm-hmm.
like, if are the labs results showing that these things are beneficial. uh in general though, I do always ask my patients if they have any questions on the medication, and if they've been taking it properly. We'll do checks every now and then, like we'll do rounds of calls once or twice a week on
Mm-hmm.
certain patients, and you'll ask them, like if they start a new medication, hey, I see you've been taking this for a couple of weeks. How has it been working for you? Have you noticed any changes? Have you noticed any side effects popping up?
Mm-hmm.
Anything going on with your body that wasn't going on before?
Mm-hmm.
Just general checks. But look, people have got to tell you, that's a big problem in medicine. A lot of people withhold information. Your healthcare
Mm-hmm.
provider is not really there
Right.
to judge you. You know what I
Right.
mean?
Right.
More or less, I need to know everything that's going on so I can know,
How to help you?
how to help you. You know what I mean? I'm not going to tell nobody on you. I'm not telling your mom on you.
Right.
Nothing.
Right.
You know what I mean? Tell me everything you're doing, what you're taking,
Right.
everything, so we could, get you going on the right path.
Mm-hmm.
Hmm.
What is one of the wildest medication combinations you've seen?
Oh man, you see it all the time. It's a big problem in medicine. Opioids with the benzos and the muscle relaxers,
Yeah.
and I mean prescribers, they just throw it out like candy now. Like
Yeah.
a lot of the opioids and pain meds is overprescribed.
Mm-hmm.
You got people that's on them for years. Uh, you got a lot of people that come in, and as long as they get their pain medicine every month, they're not worried about fixing what's causing the pain. You know what I mean? Where your
Mm-hmm.
priority with pain management should always be what's causing the pain and can I stop it? You
Right.
never want to be in those situations. And that's probably the wildest. Literally every interaction you learn in medicine is and most of your severe interactions
Mm-hmm.
are from that combo. A muscle relaxer, opioids, benzodiazepines, which are like Valium and Xanax and stuff like
Mm-hmm.
that, or the benzodiazepines, right? And you see doctors prescribe them all the time. You see people taking them all the time, and that's why you got, all those studies and all those, those big health crises with the opioid pandemics and stuff like
Right.
that. So,
Right.
it's wild. It needs to stop, but it's hard. It's going to be hard to get that total switch, unfortunately, until we find something that's less addictive to treat pain.
Mm-hmm.
And until you find that, then it is going to be tough to get around it.
Right. I think part of the medication that people are taking and it gets them like that is because it takes a long time for medicine to actually pass the FDA. Can you speak on that a little bit so
Hmm.
the people out there understand that?
Oh yeah, so I'm not this isn't necessarily my particular subject, right, with the
Okay.
medication, but in general, yes, it take years, right? Like I stated earlier, a lot of times even to work on getting a medication on the market, you have to do extensive research and studying over periods of time. You got to be able to find study groups. You need people to participate in studies. I'm sure some people watching this might have at some point been invited to join a study, and they say they'll pay you, I don't know, whatever,
X
two
amount of
hundred dollars
dollars.
a week,
Yeah.
yeah, to join the study, right? It's weird. I do advise people to try, if they are open to it, to do it. One of the biggest things is I don't want to dive too deep into it because we'll go down a rabbit hole, but
Right. Right.
like for example with the Tuskegee incident and that whole
I was
thing,
just
right?
gonna say
I
that.
think that kind of
Yeah.
followed into black people in the black community with like not having too much trust
Right.
in medicine, and especially new medicine, and rightfully
Mm-hmm.
so. You don't know what's going on. You might start
Exactly.
taking something and some weird side effect that they
Start
weren't
happening to
expecting
you.
start happening.
Mm-hmm.
So but until we get, other races are doing it. White people go do these studies and stuff, and that's why you have those a lot more extensive research on what works for them and what doesn't. And we do need more minorities in general to start participating in these studies, and being so that way it can help us learn in general in medicine what works best for black people, what works best for this type of person, so on and so forth. So yeah, it's weird. Because most people don't want to just start taking something random,
Right.
but
Right.
yeah, that's something that you see a lot in medicine.
Right. Have you
Hmm.
when you were in school, did you study much about Henrietta Lacks?
Yes. So that was
You
actually
did.
yeah, so at Xavier at the time, I'm not sure if it's still like that, but we actually, that was a required reading
Okay.
headed into college. That was probably the first book we ever read really like in the college curriculum, to be honest with you. And
Okay.
that's perfect example. If anybody ever read that book, that's pretty much spot on with what we, that question you just asked is
Hmm.
getting, and the way they use her cells to find something. No telling what's out there. You might have somebody that have a cell that could possibly lead to a cure for something. You know what I mean? Like they say we don't have a cure for AIDS. You might have somebody out there with the DNA or some weird thing going on in their body where they highly resistant to AIDS. We would never know unless we, you know what
They
I
get
mean, come
tested.
across it. Yep, or
Hmm.
they get tested. So yeah, it's definitely something that you got to look into in general.
Yeah. When you talk about AIDS, you talk about STDs. So I was young when Magic came out and he announced that he had
Hmm.
HIV, and that took the world by storm. So much wasn't known or understood about STDs at that time, as opposed to the treatments and the cures that people used back in the '60s and '70s. But when he came out, I don't think people really took it serious until
Mm-mm.
he came out and said that I have this disease. I'm gonna try to figure out what's going to happen and go from there. Well, one important thing or the advancement in that with him, I don't want to say he's the face, but he's like a major contributor to a lot of things
Hmm.
that have advanced in like the study, the research, the medication development, and things like that. Part of that is I think he had like the access to money, and he was able to do those things. I'm sure he's had vials and vials of blood that was sent off to labs and studied for
Yes.
years and things like that. We have medicine out there right now that you see the commercials. They say your HIV can be undetectable. I'm sitting here listening to
Hmm.
that as somebody who's not in medicine and say, how are you gonna make something like that? Where you cannot see that. That's like, to me that's like
Hmm.
impossible because it's in your blood. It's going to be there. You
Yep.
know. Do you see that happening more often than not with people that come in to take certain medications, or do you just see that people just flat out won't take it and they just say, "I'm gonna let nature take its course."
Also, just to be clear, so you're asking like, particularly with HIV and AIDS medications,
Yes.
do I see anybody like reject it or like choose not to? So in my personal practice, no. I'm sure there's somebody out there, but in general, the general public still have that stigma on it. You know what I mean? Where it's
Right.
almost like, let me take this serious, rightfully,
Right.
rightfully so, before, something happened to me. Because most people know, look, HIV and AIDS is not something to play with. Um, just because somebody else may have had it and they seem fine doesn't mean like if somebody else gets it, they'll be fine. That's very rare. In most cases, it progresses really fast. It's actually an autoimmune disease. So it's literally like your body kind of attacking itself. It's self-destructive from the inside.
Right.
Something you don't play with. The medication nowadays is really good though. Like, so that's one of the fields where medicine I feel made a really like huge jump.
Okay.
And look, the commercials aren't lying. A lot of times, if you do have somebody, if you take the medication regimen like it's instructed, you have people that can even have unprotected sex and not transmit it. So, like, if you're taking it right and you catch it and you make sure it's under control, it can actually be like not affect your life, like as
Right.
drastically as it used to. You have people nowadays with HIV living till 90. You know what I mean? So it's like
Right.
it's not as much of a problem. But like we spoke on earlier, the biggest problem with that is cost. I mean, one bottle of HIV medications could be pushing $2,000-3,000 for
Man, that's
30
wild.
pills. Like,
That's
you know what I
wild.
mean? So that's the biggest thing with that. Like, if people can't take it, it's because they can't afford it. But you
Hmm.
have a lot of government programs now and stuff like that that people are able to enroll in where you could get it for free, and you just got
Hmm.
to use your resources. Yeah.
Right.
Yeah.
Okay. All right. I just got a few more questions for you, sir. Um, in your professional opinion, what is one thing moving forward that we can teach the next generation about medicine?
I say the biggest thing is don't think the medication is like a magic fix. You know what I
Hmm.
mean? It is a part of your lifestyle. So most medications, even though they do aid in fixing the problem or they can help reverse something that's going on that shouldn't be happening, you do want to take the steps you have to take on your own to make sure that you're helping your body in that aspect too, right? Like I can't just take the blood pressure medication and then go kill some Popeyes every day,
Right.
Like,
Right.
and look,
Right. Right.
and people being from Louisiana, culture a big part of it. We love to
Right.
eat, we love food, and trust me, I do too. But you do have to kind of limit yourself, or at least build good habits. That's what I always
Hmm.
say. Build good habits, one good habit at a time, and before you know it, you got 10 good habits, and you don't even feel like you're on a diet, or you don't even feel like you forcing yourself to eat something you don't want to, right? Because it's a habit.
Hmm.
It's just part of your lifestyle. That's the biggest thing I'll say is like figure out what type of lifestyle changes you need to make to complement the medication that you prescribe. So that way, maybe one day you don't have to take it no more. The goal is
Okay.
to not have to take nothing, ideally. Some cases that's impossible. You do have to
Right.
have medication, but ideally for the general public, the goal should be not to have to take anything. So that's the biggest thing is knowing what to
All right.
do with it.
Good, good. Now, once I take this medication, and we talked about this earlier, I take this medication, it's not working for me. I contact the pharmacist, and you tell me, or you calling me, I'm on this new medication, and you guys reach out to me, and I say, it's not working, it's making me lethargic, and I need to do something else. Do you then give me something else, or do you contact the doctor to then try to prescribe me something different?
So yeah, I'll contact what'll happen. The first step is always contacting the prescriber, right?
Okay.
And that doctor. I usually use the word prescriber just to define so that way pretty much anybody that can write a prescription. So it might be a physician assistant, a, nurse practitioner, right? So
Right.
whatever prescriber, whoever prescribes you the medication, will reach out to them. I'll put that, I'll communicate that to them. Hey, the patient is reporting these type of reactions or adverse effects to the medication.
Hmm.
Do you mind looking into any alternatives, or I can help you kind of decide on some alternatives they could try and get them going. Depending on how serious the medication is, I'll usually tell the patient to reach out also on their end, because a lot of doctor offices are slammed nowadays. I mean, it take,
Right.
sometimes a day or two for people to respond. And if it is a medication that's like a, something urgent, then I always say, hey, you reach out, I'm gonna reach out too, so we could kind of both get on it and get it resolved. But the first step is always reaching out to the prescriber. You want to make sure you're on the same page with them. Um, if something is getting discontinued, so we both know.
Okay. And
Hmm.
my last question for you, sir. What is one thing, if you had the power to change about medicine, if you can do it? If you had the
I would
power.
say
Yeah.
honestly, if I had the power availability, so
Okay.
I kind of briefly
Talk
just
about that.
mentioned
Yeah.
universal healthcare, but availability, right? A lot of people, especially like in America in particular, don't have access to healthcare. You always see that's the biggest thing, right? Access to healthcare. That's probably the biggest issue that I would change. It's like being able to provide everybody. I think everybody deserves healthcare
Mm-hmm.
or at least the right to seek healthcare. You know what I
Right.
mean? We all human. We all want to live long lives, be around our loved ones and our
Right.
family. So that's definitely the thing I would change. Obviously, you know what I mean? Like it's hard for
Mm-hmm.
me to give somebody a $3,000 medication and
Right.
then the
Right.
pharmacy I work for telling me why we
Where's the
missing three
money?
thousand dollars. Right,
Right. Where's the
exactly. So,
money?
it's like that's the biggest problem. But yeah, definitely. I tell my patients all the time, if I could just give it to you for free, I'll do it. If I
Right.
could do it without getting fired, you know what I mean?
Right.
But
Right.
that's just the nature of it.
I got you. Thank you very much, sir. You've opened the door for a lot of insightful information and a lot of information for our culture that is not readily known. And I appreciate your expertise, and I also appreciate you being available and willing to share your experiences with everybody so we have that understanding. Is there any final thing that you want to say before we close out?
Nah, thank you for having me. It's my first podcast, so a little exciting. I was able to kind of, hopefully, I was able to help and give, quality information to people.
Yeah.
Hopefully, y'all take that. Any questions from you? Anything else, just personally, that you wanted to ask me
Yeah.
before we go?
I don't have anything. The basis of the show is just education.
Yeah,
All the shows that I've done before, everything is all about education. I believe that if we educate everybody, then they're going to take that education based on their understanding, and then they're going to apply it to the way that they need to based on their life. I'm not a judgmental person. I just want to help people in the best way I can. So if anything that I put out there previously, they want to go back and watch, they can
yeah,
watch at their leisure. Because you're going to take something. It's just like some people can see something right at first and they're watching it, but not until they go back and something clicks and say,
yeah,
this person said this one time, and now I want to go back and see it again. Just like we do with music. Let me
yeah.
rewind
Every
that
time,
back. Let me hear that line again.
hear a
And
couple
then you
bars,
catch
then
it.
hear the first time. Yeah,
Right, because it
yep,
missed me, or somebody else will say something about that, and it'll trigger something in your brain and say, you know what, I heard that somewhere. Let me find out where I found that from. But I really believe that education is the key. That's something that we've really gotten away from as far as our culture, for sure, because we've been decimated with a bunch of stuff. I feel
yeah.
like coming together, and the reason why I started this podcast, so like I said, for education, because people need to know. And the more
Yep.
that I know, the better I can go off and the better I can be. So, and medicine is a major, major thing that we, as our people, have struggled with. So
Nah, definitely.
I really appreciate you, man. I appreciate you much continued success to you, young brother. I really appreciate you, and I appreciate your time.
Nah, that mean a lot. Thank you. And shout out to you too, man. Like, we need more people, black people, especially like with these type of platforms, right? To put out information that's tailored to us. And
Yeah,
it's important. You know what I mean? So definitely shout out to you. Thank you. Keep doing what you're doing.
I appreciate that. All right, that's our show for today. Join me later on next week for another show about give and take. This is AP and Ryan for the Black Male Podcast. And as always, be good to yourself and be good to others. Peace.
God bless. God bless.